You're welcome. Thank you for tuning in. Shian is here. Hello, Shian. How have you been? How have you been? It's been a while. Please confirm that you can hear me. Am I audible? Hello, guys. Hello, everyone. Welcome. Thank you for joining in. Shian is saying, hi. Hello, Asset. I'm good. Yeah, it's good to know that you are good. Thank you. Thank you. Okay, what about now? Confirm if you can hear me now. Am I audible now? Am I audible? Can you hear me? Can you hear me now? Okay, so please type in we can hear you or I can hear you if you can't hear me. If you can hear me, let me know how clear it is. Can you hear me? Gift Uchechukwu, thank you for joining in. Where are you watching from? Thank you for tuning in. Gifts Uchechukwu. Thank you so much for the feedback. Thank you, everyone. Thank you for calling my attention to the audio. It's good to have wonderful people around you, and I appreciate your presence and I appreciate your commitment and engaging with me on this live. Thank you, everyone that's been a member of this wonderful community. I celebrate you. Welcome to the live. And for those who are coming across the channel for the first time, I want to welcome you specially. I want to say please give this live a like by double tapping on your device. Most likely you're using a mobile device, or if you're using a tablet, you can tap on your screen, or if it's a touch screen or laptop, you can tap on your screen to like the live. Okay, I really appreciate that. That helps the algorithm, like to push this live to more people. And we're having a very interesting topic for discussion at this time. So let me know if you can still hear me. Gift, where are you watching from? I'm so excited to have you join us. Where are you joining from? Is this your first time joining my live? Is this the first time coming across the channel? Thank you for the like. Thank you. Thank you for giving the third like to the live. Well appreciated. And I can see a number of people on the live, number of people responding to the poll. Do you take turmeric? Yes, 50%. No, 50%. Okay, Gift, thank you, Gift. Gift, welcome. Are you a content creator? Seems this is the first time I'm getting to see you on my live. Okay, Onye Else TV. Wow, good to have you here. Is this another channel? Is this another handle of yours? It's good to have you. Thank you for joining in. So how have you been? How are you, everyone? Let's welcome those who are just joining in. Okay, I know you. Maybe you should help with more introduction, but the name is very familiar, and I suppose you are also a content creator. Okay, are you from Ghana? Are you the one from Ghana? Yes, another channel on YouTube growth. Okay, that's great. That's great. Sometimes the changes in the names, differences in the handles, in the channel names, may not really give away the person that is connected. Except for some of us that are using our names, my sister. Okay, sister Gift, welcome. Nigerian, yeah, it's good to know. So how is your side? Let's welcome ourselves. Please, let's make the chat interactive. It promises to be an interesting one. And if you are just joining in, welcome to the live. Hi, my sister Dali. How are you? From Nila Vanegri. Thank you, Nila. Thank you for giving the like. Now it's getting more and more interesting. Thank you. 57% say they take turmeric. 43% of those who have responded to the poll say they do not take turmeric. Should you be taking turmeric? Should you avoid taking turmeric? We'll be talking about that on this live. So if you take turmeric, why do you take turmeric? For those that don't know what it is, we will be talking about turmeric and what really it is. If you look at the thumbnail, of course, you should, for those who are not aware, you should have a picture of what turmeric looks like. It's herbal, it's a plant, and it's very, very important when it comes to man and health. So just like some other plants, herbal medicines that are beneficial, so we'll be looking at this. Generally, people, as a medical doctor, let me introduce myself. I'm a medical doctor. I'm a family physician, a member of the West African College of Physicians. I like educating people about health, and that's why one of the reasons I'm on YouTube, okay? And I am interested in preventive health, preventive medicine. I talk about reproductive health, everything around intimacy and, hormonal imbalance. If you joined in some hours ago, I did a restream on hormonal imbalance, how to manage, how to treat hormonal imbalance. And I talk about that a lot, and I also talk about mental health. As a family physician, I do not just look at the physical characteristics or challenges of an individual or my patient. I consider the mental state, of course, the social health, and even the spiritual health of my patient. Thank you, Nila, for the like. Thank you. Hope we can have more people joining and more likes. We have 4 likes currently. Hope we can have more likes. Please give this live a like. Sometimes we're not getting the visibility that we need, except by your commitment and by the grace of God. You are here today, so I'm grateful for you. Gift says, any problem? I harvested 1 paint today from my farm. Oh, 1 paint of what? Paint of what? Gift. What paint of what? One paint of what? If you are just joining us, welcome to the live. Let me share with the community. One paint of what? Gift. You say you harvested 1 paint. 1 paint of what? Are you talking about turmeric or something else? One paint of turmeric. Welcome to the live. Let's know where you're watching from. Thank you for joining in. Do you take turmeric? Let's have your response to the poll. Do you take turmeric? Welcome to the live. Where are you watching from? And for those who are just joining us for the first time, please do well to double tap on your device. Just double tap on your screen and you will see the like button, the like icon increasing in number. Please add to that number and then kindly subscribe to the channel. Look for the subscribe button so that we can get to know each other, one another better. You're going to be part of a wonderful, healthy community. If you're talking about health, it's one thing that is common to each and every one of us. So how have you been? Generally, we talk about standard medical practice, orthodox medicine, talking about the use of the conventional methods for medical care, where you interact with a doctor, a certified professional like myself. As a family physician, I come across patients from different walks of life, different backgrounds, different symptoms, different diagnoses eventually, and then different approaches to their management. Okay, so when you talk about the conventional method, standard practices, it has to do with taking a history, interacting with your doctor asking you questions around your complaints, and even if you don't have a complaint, you have going just for a checkup, that's fine, but your doctor would want to have some information around you about that time. So we call that history taking, and that involves not just your complaint, but things around your complaint, your past medical history, your past surgical history, any drug history, drug allergies, any Okay, so gifts. Let's know what you invested. We are still interested in what you say you invested today. Where is your location? Please give this live a like as we dive into the discussion, and I hope you can make it interactive by sharing your thoughts, your experiences on the use of turmeric. And if you don't use turmeric, why don't you use turmeric? Let me know in the chat. Let's know in the chat why you avoid turmeric. So talking about what complaints you have, how the cause are being, what is likely to be causing it, what treatments have you received so far. Your doctor will talk around this. If you have any drug allergies, your doctor will talk about this. And then we talk about family and social history, which is a very important aspect, because our social lives, definitely your social life is an important aspect of your health. I usually talk about the definition of health. According to the World Health Organization, they say health is a complete state of physical, mental, and social well-being, not merely the absence of disease or infirmity. So it's a complete state. And if we talk about something being complete, it means we have factored in every part that is important, and including even the spiritual aspect of a man's life. So if you are talking about being healthy, being a complete person, it means that mentally you are stable, it means that physically you are fine, it means that your social network, social connections, whether it's on YouTube, TikTok, Instagram, but the physical connections are very important. We should not take that for granted. You should still learn and value physical relationships, people that you can see, people around you, your community. Okay, we should not allow social media to take away that from us. Okay, so that's very important. That is health. And if we talk about conventional medicine, we also look at examination that needs to be done, general examination, specific areas or parts of the body that the doctor may need to check. And then following this will be a diagnosis or differential diagnosis, likely disease condition that the doctor may be thinking of as the situation of the individual. All right, so before you now go into treatment, except for emergency situations, before you go to treatment, most likely your doctor will request for some investigations. So that's just about the conventional standard practice. But there's something that we call complementary and alternative medicine. Complementary and alternative medicine. When it's complementary, it means that the other method of treatment, for example, acupuncture, the use of meditation, that they could complement this orthodox medicine practice, that is use of medications that have regulations, medications that have gone through trials and have been approved for use for humans. Okay, so let me know if you can hear me. I hope I'm still audible. If you are joining us, let's know where you are joining from. Welcome to the live. Welcome to the live. Where are you watching from? Remember, we have a poll that you can respond to. If you are yet to respond to the poll, do you take turmeric? 57% of those who have voted say they take turmeric, while 43% are saying no, they don't take turmeric. So if you take turmeric, why do you take turmeric? If you don't, why don't you take turmeric? Welcome to the live. Please introduce yourself. It's too quiet here. Nila, are you still there? Gifts, are you there? Xian, are you there? S3 Rag 5, are you there? Let's know who is here, who is still here, and who is just joining in. I know more people will be joining in as we move on. All right, so but if you are new here, welcome to the live. We're talking about the interesting, amazing benefits of turmeric. Thank you for the 5th like. Amazing people here. It's getting more interesting. And if you are yet to subscribe to the channel, please look for the subscribe button and let's get to connect. Let's get to connect. Let's have more responses to the poll and more interactions in the chat. All right. So if you don't introduce yourself, I may not know that you are here, and I may not know how to welcome you specially. Okay. If you are new here, let's know in the chat. It's not going to cost you anything. Okay. Just drop a comment in the chat. Just greet us, greet everyone, and we get to know you better. Thank you for the likes. So we're talking about complementary, meaning that this can help to support or improve the care that an individual is receiving from taking medications, while the alternative means that we're not going for the orthodox medicine, drug, the pills, the injections, but we're going for alternate, like going straight for acupuncture, going for uh, say turmeric or some other herbal medicines. Okay, but there is the integrated practice of medicine, which actually combines the standard medical practice with the CAM, that is the complementary alternative medicine, that have proven proven to be effective, proven to be safe. So there are some studies that have been done around some herbal medicines that have been proven to be safe. Do you know about zobo leaves, hibiscus flower? That some research has actually been done around this to show that this is beneficial for reducing high blood pressure. Let me know in the chat if you have come across this information before. Welcome back. Please let me know if you can hear me. Please let's know as soon as you join in. Let's know. Let me know if you can hear me. Welcome or welcome back. Where are you watching from? Thank you for the like. Please confirm that you can hear me. Am I audible? To make it so bright. Let's know where you are watching from. Let me know as soon as you can hear me. Let's make it this. This is cool. Welcome or welcome back. Let's get to know you. Are you new here? So, as I was talking about earlier, I was talking about the different approaches to health management when it comes to using the orthodox standard medical practice, when it comes to use of complementary medicine, and when it comes to the use of alternative medicine. All right. So, but there is the integrative, uh, under which I believe this turmeric actually comes, and that has to do with the fact that research, different studies have been done around this turmeric, and it's been found out to have great benefits, amazing benefits. I will be talking about some of these benefits in the course of this live, but I would like to meet with you, like to chat. Let's connect. Where are you watching from? All right, so let me know if you can hear me. So, interestingly, there are questions that people ask around turmeric. It's that golden yellow spice has been described. and it's actually something that dates back to India and Asia, where this are being used. They've been in use for years. They've served as herbal medicines over the years, and many parts of the world, even though they are now being produced in many parts of the world, but India is said to be producing turmeric in large numbers. And the benefits are now being embraced by many other nations of the world. So people ask, what does this turmeric, what does it do? Why is it important? And we'll be looking at that. Some people ask questions around this. I'm going to be giving some information and clarification around the use of turmeric. Why should you take turmeric? Is it really beneficial? Who should be taking turmeric? What are the benefits? How should you take turmeric? Let me know if you can hear me. Am I audible? So some people are asking, what does turmeric do for the body? What does turmeric do? Now, one thing that you need to know is that turmeric has antioxidative and anti-inflammatory properties. There's a substance in it called curcumin. It has that high anti-inflammatory effect because of that component. Now, it helps to remove free radicals. Those are waste that the body does not need. It actually helps to protect the cells of the body from damage. So, for example, it can help in some kind of supportive treatment for heart disease, people with cancer, and any inflammatory condition. All right, so you should take note of this. All right, so another question is, what happens if you decide to be taking turmeric every morning? Okay, it can help to, of course, boost your immune system. It's very beneficial for boosting immunity, and then it can also help with improving your digestion. Very important. If you have the problem of indigestion, you can take some turmeric and you will experience this benefit. It's also very good for skin health. Turmeric has been found to help to even lighten the skin. Okay, no wonder some people actually include into their soap making, and because it's been found to be helpful for the skin. So the question is, who should be taking? Generally, everyone should benefit from the use of turmeric or intake of turmeric, but there are some people that should be careful, especially if you are diabetic. Turmeric has been found to lower blood sugar, and that can be something that can lead to hypoglycemia, excessively low blood sugar for people who are also taking medications for diabetes. Pregnant women should avoid turmeric. Breastfeeding mothers, people with gallstones or kidney stones, people who are on some form of hormonal treatment should also avoid turmeric. Interestingly, there are some certain conditions that turmeric has been found to help in treatment. I'm going to start to mention some of those conditions. In allergies, some allergic, for example, rhinitis, allergic rhinitis, individuals with recurrent nasal discharge, you know, some form of allergy, they need to take turmeric. It's also helpful in giving them support treatment. And seasonal allergies, mental health improvements. People with mental health challenges, for example, depression, is been found to be helpful in in improving mood. If about 1 gram daily is taken, it's been said to be helpful. Also for treatment of bone problems, talking about arthritis, osteoarthritis, some other forms of arthritis. Turmeric has been found to be helpful in case of indigestion. I mentioned that earlier. Also helpful for heart health because of these anti-inflammatory and antioxidative properties. Turmeric is good for people with inflammatory bowel disease conditions like ulcerative colitis, Crohn's disease, because of the anti-inflammatory benefits or effects. Also, in some conditions that are common with old age, for example, in Alzheimer's and in Parkinson's disease, turmeric has been found to be helpful in neurodegenerative conditions. Now, what other conditions? Of course, for cancer, it's been found to slow the growth of abnormal cells. So, people who have been diagnosed of cancer can take turmeric, and interestingly, it's better taking as a form of prevention than just taking while the individual is on treatment for cancer. Also, I mentioned for type 2 diabetes, it's been found to be helpful as inflammatory agent to reduce the hyperglycemic state. It also helps to improve the response of the cells in the body to insulin. So it helps to take blood sugar and give it that good control that the body needs. It's been found to be protective for the kidneys. Also, in respiratory conditions such as chronic obstructive pulmonary disease, the anti-inflammatory effect also seen in these conditions helps to calm the lungs and helps to deal with symptoms such as cough, wheezing, because of the anti-inflammatory and antioxidant
oxidative effects or benefits. So what next? Let's look at another question. Uh, what are the combinations that people can take turmeric? I've heard people mention that they take turmeric and ginger and garlic. Some take lemon tea about the same time. Even though these are beneficial, but you need to have some caution when it comes to taking this herbal medicines. Okay, it may come in form of the roots. It may be in form of the spice blended. It may come in form of the tablets or capsules. In whatever form it is, you will get the benefit, even though benefits may differ depending on certain conditions, which I'm going to mention. For example, turmeric and ginger will still both have anti-inflammatory effects, and so it will definitely, in combination, will help to reduce symptoms from inflammatory conditions. Turmeric and black pepper, this is also very good combination. Even if it's just half teaspoon or 1 teaspoon of turmeric with a pinch of black pepper, this helps in the absorption of turmeric. Turmeric is even said to be better taken with food or after food, as food helps in its absorption. Interestingly, there is no particular time of the day that is preferred. Okay, research has shown that there is no difference, so to say, in whether you take turmeric in the day or at night, but it's related to diet. Food is important in its absorption, especially fatty food. Can turmeric help with belly fat? Yes, yes. It's been found to also be helpful in flattening fat in the tummy. Of course, if we talk about the benefits for the skin, it helps with skin lightening. It's good for certain gastrointestinal conditions, even though I will still mention the side effects that turmeric may have. And I need to mention first how to take turmeric before we go into other things like the side effects. The best way to take turmeric will be after a meal, you know, with a meal or after a meal. Whether you are taking, you may now choose whether you want to take as a spice with your food or you want to take as supplement. Better to take with your food. So, what are the side effects? It can cause nausea in some people. Some people, it could be vomiting, some gastrointestinal disturbances. Some people may even have their ulcer worsening. For people that are taking some medications, which I'm going to list, you need to be careful with the use of turmeric because turmeric has a thinning effect on the blood. So if you're taking medications such as aspirin, you are taking amlodipine, tamoxifen, levothyroxine, losartan, these are drugs that can interact with turmeric. But blood thinners such as aspirin, clopidogrel, these are medications that helps with blood flow. So if you now add turmeric and you even add ginger to this, you will be putting yourself at risk of uncontrolled bleeding, which is not something we want to experience. So let's talk about how to take turmeric. Okay, I've talked about that. Just going through my notes. Okay, so there are some supplements that you should not take with turmeric, And such supplements, apart from those blood thinners, other supplements include iron supplements, which may lower absorption of iron. So with turmeric, there could be lower absorption of iron if you are taking iron tablets about the same time. All right. So with turmeric, you have more of chronic inflammatory conditions dealt with, like arthritis, whether it's psoriasis, whether it's osteoarthritis, ankylosing spondylosis, all kinds of bone-related problems too. And then the ginger, if you take ginger with it, will help with digestive issues, and then some abdominal problems, abdominal discomfort. All right. Some people ask, does turmeric help with sleep? No, there's no known benefits for sleep because there's no sedative in turmeric. All right. Okay, I think I've been able to cover some of the things in my notes when it comes to the intake of turmeric. So, turmeric has amazing health benefits, and some of those are related to the curcumin that is present in turmeric, the ingredients, and it's responsible for anti-inflammatory effects that turmeric serves. And turmeric can be used with different other herbal plants, like ginger, garlic. Interestingly, has antioxidative effects, which some of these plants also have. So these are very helpful plants that we may need to include. Studies have actually shown that turmeric has high benefits for people with osteoarthritis. And I want to encourage you. Of course, you need to speak with your doctor to be sure, for proper evaluation, to be sure that you can take turmeric, especially if you are taking some orthodox medicine already. You need to have a chat with your doctor to see how much benefit you can get from turmeric. And you should avoid turmeric once your doctor says you should. Okay, so proper evaluation is very important for any symptom that you have, any medical condition, so that proper personalized care can be given to you. So, where are you watching from? Thank you for joining in. Turmeric has amazing health benefits. So, I hope if you have not been taking turmeric, like I said, discuss with your doctor, and I'm sure you will be directed appropriately if you're going to get benefits from taking turmeric. So let me know in the chats, do you take turmeric? Interestingly, 57% of people in the poll say they take turmeric, while 43% say they do not take turmeric. Okay, I would love to really know why you are taking turmeric, and what are the benefits that you are getting from taking turmeric. All right, and then for those who are not taking turmeric, why are you not taking turmeric?